If I was beginning my journey with low thyroid or Hashimoto's or maybe even hyperthyroid, I would suggest that everyone think about the Thyroid Fixxr program that Dr. Amie, I think she just passes twice a year now, she offers. It gave me such a great understanding of my thyroid, and it's a lifelong journey. So what I need to do to continue on the journey for success, and that's what she says in that program, I'm not happy unless you get to optimization land. And that's exactly what she teaches you how to do. There's a roadmap. I would suggest it to anyone. It's well worth the time, the effort, and the money that you put into it. Before the program, I was struggling. There's a lot of information on Google, and I didn't really know where to start. Luckily, I came across Dr. Amie, and that's where I found the program, and I jumped right in, and it's been a life changer. After I completed the program, my energy levels have increased because I have learned how to manage the supplements and to work hopefully with a good doctor who can prescribe the right medication for me. So energy levels are definitely up. When I started the program, I was really dealing with a lot of anxiety, a lot of stress in my work. Fatigue was crushing. Through that whole course, taking each, segment that she would present taught me how to deal with the stress better, what supplements I needed to take to increase my energy level, get rid of the fatigue, and just learning how to deal with the stress, the everyday stress of, life and having Hashimoto's. So before I started the program, I have the same health provider, and I didn't really know what questions to ask. Dr. Amie gave us an outline of every question that we should ask a doctor, and she taught us how to read our lab level and to present an outline to the doctor so that they would be able to understand where we were coming from as patients, and that they would be able to prescribe the dosages that were going to get us to the optimal level, because a lot of the doctors don't understand that. I can say that, yes, reading the lab results has let me know that my T3 may need to increase, or my T4 may need to go down. Depending on what type of thyroid medicine you're on, you base it upon those T3 and T4 levels. You don't really chase your TSH, which she taught us, and reverse T3 is extremely important to know, and that's something that my doctor doesn't even test. I have to pay extra for. So once I learned those levels, then I also understood why I was so tired, and started taking the Thyroid Fixxr right away, which increased my energy levels immediately. The Fixxr supplement that made the biggest difference for me so far has been the Thyroid Fixxr. I felt more energy within 2 days of taking that supplement. The most valuable part of live coaching with Dr. Amie is she's such a real person. She says everything in plain language that you can clearly understand. She doesn't talk to us like we are, we don't know what we're talking about. She talks to us like regular human beings and gives us the confidence to go to our healthcare provider and demand that they make us better. I knew that I had everything that I needed to go to my healthcare provider and say, hey, listen, what you're doing is incorrect and I need you to help me. It just made me feel confident. And I think that there was that aha moment. A lot of the coursework is listening to her talk. And, you may have heard it before somewhere else, but when she said it, you're like, oh my gosh, I totally understand that now. The thyroid community has been great. You can post a question in the group chat whenever you need to, and they answer within sometimes minutes. And it may not be Dr. Amie, but she's got a lot of contributors on there that are experts. And they're always very encouraging, asking the right questions, and making you think about your situation and what you can do to make yourself better. I look at it every day, multiple times a day, just to see some questions answered that, maybe I didn't think of. Hi, I'm Darcy Lehman, and I'm from Mayville, Michigan.